At the interactive session on evaluating the progress of Nigeria's response towards ending child marriage and other harmful traditional practices on the girl child, they say risk factors are low levels of education, ignorance, poverty, but reasons for increase of the menace is geared towards averting teenage pregnancy. But these stakeholders are working to provide the necessary support for victims and communities.
Driven, community-led initiative, but also they are testing various models, the Tostan model, but also the gender transformative approach models that they are also testing. One core intervention of the civil society in this endeavor is affording support to victims, support being psychosocial support, or support being affording a shelter to the victim.
They equally state the challenges faced during the course of executing projects.
There are some states that have not passed the Child Rights Act, and there are some states that have not passed the VAP law. So we believe that advocacy to the governors is also very key.
A lot still needs to be done to mobilize action around domesticating the Child Rights Act in Nigeria. Efforts have been in place. We've moved gradually, getting more states to sign. But as civil society, I think our big concern now is not just about the signing, but what is even the substance of these laws that are being domesticated in some of the states, especially some of the states in the north that are still significantly and consciously excluding the age of the child of marriage.
The recommendations call on all actors to increase advocacy and ensure full implementation of laws, among others.
Also to see what the milestone we achieve, we hit as a result of the sustained funding that been supporting us is very significant to us. It will also give us more skills, more kind of encouragement to double the effort we are doing in fighting the negative menace of all form of traditional harmful practice, female genital mutilation, child marriage.
We have to close the gaps in our policy process that better protect the rights of children, especially protecting them from child marriage and other harmful practices, and also protecting them from various forms of gender-based violence. The other challenge and where we're making recommendations is that we need to improve the coordination and the harmonization of even our efforts, not just as civil society organizations, but as stakeholders working in the space.
Child marriage and female genital mutilation threaten the well-being of millions of girls around the world, existing for generations as manifestations of gender inequality, human rights abuses, propagated by discriminatory norms that devalue girls. But these stakeholders want to stop to such practices to enable young girls attain their full potential. Aisha Salihu, Trust TV.